Шановні колеги, ми продовжуємо роботу.
Dear colleagues, we continue our working day, and the topic of our next briefing is challenges related to healthcare and social guarantees in the ATO zone and the temporarily occupied territories. Practical experience of NGO Eleos-Ukraine. Our guests are Oleksandra Ashrapova, Coordinator for Regional Development and Project Monitoring, Eleos-Ukraine Program Manager, Afanasy Yavorsky, Coordinator of Lugansk Region, Leader of Eleos-Donetsk, Bishop of Lugansk and Severodonetsk, Sergiy Gorobtsov, Coordinator for Donetsk Region, Archpriest of Donetsk and Mariupol, Director of Eleos-Donetsk, and manager of International Renaissance Foundation, Kseniya Shapoval. Good afternoon, dear guests. I would like to tell a few words about our NGO, our main priority today in the times of hostility. This is providing support to civilians. We focus on healthcare, so in ATO zone, in gray zone, people are not provided medical services because hospitals have been ruined and there is no qualified medical and legal services. People do not know where to get medicines, where to get drugs from the state, even if they are provided by the state. From 2014, we have had projects supported by Renaissance Foundation such as Единство and Avtopoezd. We talked about those projects in Ukraine Crisis Media Center. Eleos-Ukraine, this is an NGO which is just for fashion reasons. There are not so many NGOs currently which provide consistent support to those people in need. This is our priority, to provide medical care to our people. I will give the floor to other persons. I'm not a practitioner. I saw letters which wrote those people who visited our office. We have more than 100 letters from ordinary people. They even contain grammatical mistakes, but all those letters, they are thank you letters. And I would like to thank those ordinary people who were volunteers. They provided money, they provided drugs, they provided toys and their warm greetings to Donetsk and Lugansk victims of war. These people, they see the sense of their life in assistance to those people who live in the area of conflict. And now we give the floor to Oleksandra Ashrapova. I will not stop in detail on the problems which Donetsk and Lugansk region experience now. We have people who live there. We understand that the best thing is to provide platform for people living there to talk about their problems, but I will tell about our activities, how we try to provide maximum assistance to people living in the zone of conflict. We formed 2 teams in Mariupol and Belovodsk. Each team has a medical consultant, lawyer, and regional coordinator. Main goal of every team was to provide comprehensive social assistance to every individual and to develop an algorithm and mechanism to resolve specific problems of this individual and to issue such route reference list to the person. During 10 months we have managed to form the teams and people which are not only professionals but who became case managers. They have organized sustainable network of all social service providers, and they've managed to consolidate the resources on site. We've managed to join governmental structures and religious organizations for the one cause, to assist the victims of conflict, of hostilities, who live in need. One of our main achievements is the opportunity to move people from the territories and to supply humanitarian tangible aid to the occupied territories of Ukraine. It was very important for us that those consultations and assistance which we provided, they were regular, not one time. Any individual who applied to us, those individuals, they know they can address us anytime if they have any problems. They can get help on site. These people, they know now that someone cares about them and will stand for their interests wherever he or she lives. Until the problem is resolved. We have provided assistance to more than 500 people, more than 200 people. We have provided services as professionals. There were really serious matters concerning medical care and social issues. We would like to thank very much International Renaissance Foundation. Although these victims who were provided assistance, they are just small percentage of all the victims, but we will not stop. We will continue our efforts, and we offer you to join us. We will always be glad to see you. We can provide an algorithm which has already been tested, how to help individuals to resolve specific issues. We give the floor to Afanasy Yavorsky, Bishop of Lugansk and Severodonetsk. Good afternoon. I've been engaged by Eleos-Lugansk NGO as a leader, and I work for this organization in Lugansk region because many people living in gray zone, especially those individuals who live on uncontrolled territory, so they experience social problems, and the chief of Eparchy, Bishop of Eparchy, which covers both controlled by government and uncontrolled by government territories, and people who addressed us, they were both Orthodox Christians and Muslims and people of other religions. We are now also We are also in exile. In Severodonetsk, we established the center of providing assistance to IDPs who needed some help, thanks to Father Sergiy and Eleos-Ukraine. Humanitarian assistance started to inflow, and we started providing people with food and clothing. And 1 year ago, the project Hand of Help opened. I am the coordinator of this project, and those people who addressed me, they were readdressed to Belovodsk. This is the town, the first town on the contact line between Lugansk and Ukraine, the only passing point where IDPs from LPR could get. So all our church servicemen provided assistance to such people in need because they have very many problems. I'm very thankful, sincerely thankful to Eleos-Ukraine that they engaged us in the activities, and we implement this project, and I'm very thankful to International Renaissance Foundation that they provide funds and humanitarian aid and food and clothing. Their assistance is very grateful. I hope that in future we will continue our fruitful cooperation and we will help even more individuals. Thank you. Thank you very much. I'm giving the floor to Lyudmila Duvanova.
I work as a lawyer in Belovodsk, Lugansk Oblast, and I am an IDP. According to the data, the region is 26,000 and IDPs are about 49,000 people. That's why for me, it is really important that I have such an opportunity to provide help to those people who are in need and who are in stress and they do not know about their rights, where to address to, what help they can get, and in what way they can realize their rights. Sometimes it happens that after the consultation is provided, people sometimes cannot realize their rights, and we help them. Today, we have 45 claims to court, and 5 are under review. The rest are satisfied. And difficult procedure of getting death and birth certificates, because to get these certificates, a person should address to court in order to establish the fact of death and or the fact of birth, and only after this, the person who lives in the occupied territory or IDP who addresses to help his relatives, then so they should address to court to get these documents. Also, there are cases when people need help to have electronic permits in order to reunite with their families, and these are people who live in occupied territories. They address to us, and people who live in controlled territory. Also, there are people who address for help via Skype connection, and they are provided with information about organization that helps, and it shows the level of trust that people addressed us, and we provide help in different ways. Also, important issues are rent of housing for IDPs, getting documents, human resources in governmental bodies, the specialists are not able to deal with the amount of people who need this assistance. This is more than 400 people a day, so we help them, and due to this project and due to Renaissance Foundation, we were able to provide food and medical stuff to people who need this, and also people addressed us individually, and we provided help to a girl who is ill and needed help, and this work is really good, and people address. They first do not want to tell us their phone number, but then they return and they are more open and they understand that we will help them. Thank you, Ludmila. The floor is given to Kseniya Shapoval. Good afternoon. Thank you very much, and thank you for your interest in our project. Access to medical assistance for people who are in the gray area and in the territories that are not controlled by the state. This is a very important issue. All clients that we deal in the framework of this project, they are not guilty in the situation. They just cannot leave those occupied territories, and we should understand this. And we were concerned as a foundation that people who are really heavily ill, they couldn't leave the territory. And this is not typical activity of our foundation, but it is really important to establish the algorithm how to help those patients. And those 500 people, they got help in the framework of this project, and this is good indicator. This is 500 lives and 500 families touched by this conflict who have the right to get this quality medical support. And globally, we cannot solve this issue by our own efforts. And donors and civil society and others help and assist such projects, and we want to address to our colleagues and journalists in order to provide this information, because problems become more complicated, because people with chronic diseases, they need costly treatment. These are oncology patients, hepatitis patients, and together we can provide access to quality medical services for these patients. And also the issue of documentation is of importance. The project shows that the system of that the system is not friendly to people who are in difficult situation, and preparing the documents is timely, and lawyers and para-lawyers and managers, they should deal with it, and Ukraine as a state should pay attention in the situation to improve the situation with processing of documents, because people cannot restore their documents. This is costly, and then they do not know how to do this correctly. Also, we would like to draw your attention to the fact that people who address for help in the territory of Ukraine, they are citizens of Ukraine. And we should not deprive them of these opportunities. They should be provided with help. And that's why I believe that support of the community is very important. And I would like to thank those colleagues who were involved in the project, because your activity, directly practical activity in the territory, whether it is controlled or not, and intermediary activities are of importance as well. Thank you very much. Thank you, Kseniya. And the remark from Sergiy Dmytriev. We should have had one more, because Sergiy, the one more speaker who is very important coordinator, but he is absent today. And I would like to tell about the system of work in the occupied territory. We have a hospice. There are 72 people there, and it exists due to quality medical support, and also there was communication established with the DPR authorities, and they allowed the center to stay, and all elderly people who are paralyzed they are brought there from neighboring villages, and they said that we asked to have access for to deliver food, and this hospice exists, and we think that in winter there will be bigger number of it is in Grekovo-Oleksandrivska. You can look you can watch this information on our site. You can print a House of Mercy, Dom Milosердия, and you can find information on our page. So people who get from Donetsk Oblast, who come to get treatment, if they cannot get treatment in occupied territory because medicines are lacking, and many of them cannot go, for example, to Rostov-on-Don, to Russian Federation, because relatives or doctors that they consulted with are in Kyiv or in other cities of Ukraine. That's why it is safe for them to cross the border, and they know that they will be welcome, and they will have that in Mariupol they will get food, and in Mariupol we have a canteen that is free of charge, and it has been working for 12 years already, and this is a charitable canteen without any documents, so a person can come without any documents, and 100 people are fed there. The center is in the heart of the city, and the people won't ask you whether you're an IDP. We just feed people. We provide them with clothing, a person can have shower, and to get some assistance. Our know-how is that we address religious organization. When people do not know where to get help, they just go to churches and ask for help. And for us, it was a bridge in order to refer to NGO or to state structures when a person comes, in order to provide safety. And it was Orthodox Church of Kyiv and Patriarchate, and this church is represented there. There are priests in the region, and the religious organizations are a huge resource, and they can professionally work in social sphere. And we have pictures, and our bishop who helps patients, he helps patients, and he brings medicines to people, he helps people, and after shelling he goes to remote areas and visit poor, lonely people, and no one guarantees his safety there. Even social workers do not want to go there. So our project continues, and we have been working in this direction before we got grant money, and we are going to continue. We should remember that people like us live there, and we all can get in difficult circumstances. So the organization is represented mainly by IDPs. The Bishop Nafnasi lived in Lugansk, and Lyudmila is from Lugansk. Bishop Sergiy is from Donetsk, so we provide help as equal to equal. We know the needs of people and how to help them. And there is trust between patient and the social worker. Thank you very much for this press briefing. If you have questions, we are ready to answer. Do you have questions? Please be brief.
Good afternoon, Lydia Khovanskaya. Can you specify how many people need assistance and what kind of assistance? Medical supplies or other assistance, approximate figures on uncontrolled territories. On uncontrolled territories, people who applied to us, there were over 3,000 people in Donetsk region. In Lugansk region, we can't say how many people were addressed. We worked through our representatives on the territory controlled by government. Maybe Ludmila will tell you. We have figures for territory controlled by government concerning IDPs. According to our latest information in Belovodsk region, there are more than 49,000 people, while the population of Belovodsk region is 26,000. So this is twofold. IDPs are the same quantity of people, and all of them need place where to live and medicines and food. The person can be physically in a good state of health, but his psychological state should be addressed, because people under stress, they do not understand their rights. We need to coordinate them where to address, what service they can get. If they don't get this service in some governmental body, we help them, we assist them to provide assistance, so that they are provided assistance by civil servants.